I'm Andrew Pieri. I'm an oncoplastic breast surgeon working in Newcastle upon Tyne in the UK. Within my practice, I perform breast cancer surgery, I perform breast reconstruction surgery, and then I have a cosmetic practice in the private sector. There's a number of different indications for using macrofill vacuum. In my practice, I use it for, first of all, in breast cancer cases. If you do breast conserving surgery, so a lumpectomy, it's possible to sometimes leave behind a defect, so a dent in the breast. That's easily filled out with fat transfer using the macrofill vacuum technique and kit. Sometimes following radiotherapy after breast conserving surgery, you have a global breast reduction in volume, and global fat grafting can be used to just augment the breast for symmetry with the other side again. In breast reconstruction work, following a mastectomy, if the reconstruction has been with autologous tissue, such as an LD reconstruction, that's the perfect scenario for using fat grafting with macrofill vacuum. And you can use that to either globally increase the volume of the breast to avoid adding an implant behind an LD muscle, or sometimes if over time you have some lateralization of the reconstruction, you can fill in a medial defect with fat easily. Within implant reconstruction practice, you can use fat grafting to thicken your flap and create a more natural appearance. You can also use a hybrid technique and replace 30% plus of the implant volume with fat using macrofill, and that gives a very natural, almost breast augmentation appearance. Or you can either, if you want an autologous look, replace a whole implant over time with a reverse expansion technique using fat grafting. Within the cosmetic sector, it's also possible to do a bilateral augmentation using fat. Sometimes that requires more than one sitting. It's also utilized a lot for asymmetry surgery, particularly with tuberous breast deformities. There's a few advantages of the macrofill vacuum kit compared to some of the other fat grafting kits that I've used in the past. First of all, it all comes packaged as one piece of kit, so it's easy to put together. You don't have to try and remember or get somebody to go through it with you again every time you're doing a case. It's also quite an ergonomic kit. I find that with some of the systems I've used in the past, there's some fat waste within the different collecting materials within the kit. That's not the case at all with the macrofill kit. I also find a finer quality of fat that looks truly like an emulsion without any stringy bits of fat in it, which I've had from previous bits of kit, or thicker globules of fat that occasionally almost even block the syringe when you're injecting it, which sometimes results in a less even injection. Certainly with the macrofill kit, I've never had a problem like that. It's a really fine emulsion. One thing I've noticed about the quality with the macrofill kit is it seems to be superior to some of the other kits that I've used. One of the first things I noticed, and seems to have then been consistent when I've used the macrofill kit, is that you're provided with this really fine emulsion that injects very smoothly. You don't come across during that injection suddenly a case where your syringe feels blocked and then suddenly it squirts too much through in one go and you end up with a less even injection. One thing I've noticed is that patients give a lot of positive feedback more recently with fat grafting since we've been using the macrofill kit. And I think that's predominantly due to a smoother cosmetic appearance. I think we get a lot less fat necrosis and lumpiness in the tissue, and I put that down to probably having this smoother emulsion that we're injecting.